So many questions on glycemic index and glycemic load, so I thought we just would back it all up and start from the beginning, right? So we talk about this in the Lifestyle Center when we talk about either preparing a patient for surgery or in the non-surgical weight loss program. The concept of glycemic index's load is way more important than we used to think it is. So if you imagine that when you eat a certain food, your body will ingest the food and it will convert it to sugars, and those sugars will be in your bloodstream, and we can test it. So when we think about glycemic index, that has to do with if I gave you a certain food that had 50 grams of carbohydrate in it. So the 50 grams of carbohydrate in the food, you eat the food, and it bumps your blood sugar a certain level. And the problem with bumping your blood sugar quickly, especially if you're genetically wired to be big, is it takes that extra sugar out of your blood, and instead of raising your metabolism to burn the sugar, it will store it away as fat. And this is why this whole glycemic index business means so much in terms of trying to lose weight with patients. Now, it's one more step more complicated though, and the real number we want to get to is the glycemic load. What the glycemic load is it says, well, we know that the glycemic index has to do with 50 grams of carbohydrates, right? But some of the foods we eat will not have 50 grams of carbohydrate, and the best example is watermelon. So watermelon has a really high glycemic load, but you've got to eat 3 watermelons to get to the 50 grams, and that will definitely bump your blood sugar. A glycemic load has to do with, well, what would be a meal dose? You know, what would you really eat? What would be an appropriate meal dose? And then let's take the glycemic index and convert it based on that. And so you get a much different number. So some foods have a high glycemic index and have a high glycemic load, but others have a high glycemic index, but if you eat a small, normal eating amount of it, the glycemic load is not that bad. So again, the concept is how much sugar gets into the bloodstream when you eat the food. And if you have the genetic wiring and the metabolism to be a big person, your body will take that extra energy and store it away as fat, and we just can't have that, right? Does that explain that? Everybody's nodding their head yes. I'm Dr. Robert Woodbury, Healthy Steps Bariatric and Metabolic Center.